NCHR was created to be a watchdog and a bridge and a voice. And our core function really is to inform the government of gaps, problems faced by civil society, by people, by women, by vulnerable groups, and supporting victims and survivors through our civil court that we hold, the hearings we hold, the sumo moto actions we take, and then the investigations that we do. Today's report is really a fulfillment of all those mandates. You have heard about these horrible stories, and they come to us quite regularly. And every story is like a Pandora's box. You try and resolve that story, and then a bigger story comes up, and a bigger story comes up, and then you find gaps in policy, gaps in laws, huge institutional failures. The institutions exist, the laws exist, no one reads the SOPs. You have 300 healthcare centers registered. How the hell are they registered? You want to know. How are you operating in systems where women are just trapped and held and abused? I'm really honored to be joined by Sherry today. She really is a parliamentarian of extraordinary moral clarity and courage. And few people have really understood what it means to fight for women's rights than Sherry. And she's been through difficult times of the last weeks, and I'm really, really honored for her commitment and her magnanimity of being here today. My question to you, Sherry, is this. When women in Pakistan can be confined in private rehab centers simply for exercising their agency, be it their right to choose their husband, to assert their inheritance rights, to simply challenge the patriarchal authority of their family, we are sort of dealing with the parallel system of social control. And we see this control in every aspect of a woman's life. We did a research on the Nikah-nama, and we found that 98% of Nikah-namas for women in Pakistan, they cut out the right to divorce and the right to maintenance, which is our God-given right. So I want to ask you, what does this really mean, this persistence of a system of control, and what does it say about the gap between our laws, our international commitments such as CEDAW, and the lived reality of the women in Pakistan?
Is this on?
It's close.
Okay. Right. Thank you, Rabia, if I may call you by your first name. First of all, I want to say that I am overwhelmed, and frankly, I don't think I'll sleep tonight after seeing and hearing what you have disclosed. As you remember, Rabia, we've discussed these details on the phone because I don't know, I read about them and I called Ms. Javeri up, and it was horrifying to me that you can have this Victorian set of detentions in the 21st century in Pakistan, especially in the capital, which is not so difficult to run. It's a small city compared to the others in Pakistan. So here is a situation that I'm having, even now, trouble wrapping my head around in terms of the egregious, gross, and horrific violations of not just laws. Clearly laws have been violated, or the architecture of laws is simply not up to the standard, which we have to discuss as well, but also the state of the medical profession, which allows this level of abuse, that is the only word for it. It is a system of institutionalized coercion, abuse, and a weaponization of that medical facility or degree to exert illegal, I would call it completely illegal, control over women's lives. Because as we all know, Rabia, that you have brought many such reports to public light, and many of us are very aware of the 50 shades of abuse, coercion, and manipulation that goes on in women's lives across the class divide. in all of South Asia. It's not just Pakistan, but here we are talking about our own country, and here we are in a position, both you and I, to try and do something about it. Well, so you have cast the first ball, shall we say, in everyone's court. And first of all, I want to say thank you for that, because, and to the brave young lady who has done this research, I would very much like to see both of you in my office before this weekend, if possible.
Sure.
Or over the weekend. I work over the weekend. If we can't find time with the banal work we tend to also have to do. Every work involves things you get bogged with. But while session is on, which gives us a platform, I'm certainly going to want to go through a loop of how this is preventable, how the licensing cannot be reduced to a capacity issue. That is not enough, in my view, that they cooperated in the end, the licensing authority, and they explain this as poor capacity. Well, no, this is downright abuse that is just not acceptable at any level in any century. If you, I've seen what is known as a film, I can't recall which one, about Victorian England, how troublesome women, they would just identify hysteria as a problem, that, oh, she's hysterical, let's just give her some smelling salts and therefore laudanum, if you recall, and that's also a drug. And then a husband could just commit a wife that is not playing by his rules to an asylum, where this level of systematic coercion, abuse, and actual institutionalized neglect of patients and inmates, I call them inmates because these are not care centers, in my view. You saw what they looked like. I can barely speak after hearing that and seeing that. And so I think this is worse than even a prison, because in prisons, your family knows you are in that prison. There is a jail manual that you have to go by. Basically there are laws and institutions built around your penal codes, criminal codes, built around various correctives to what you can endure. And I'm not suggesting that prison is a good place to be. I mean, I've been in all sorts of political situations. They often say it's a good idea to move from lockup to a jail, because in lockup there are no rules. This seems to be an even darker version of that lockup.
Yeah.
Because in the lockup too, people know that you are in that situation. And I remember being sent to lockup as a journalist over a weekend for printing something. This is long before I joined politics, and I remember the publisher saying, but anything could happen on the weekend because you have printed a story of institutionalized abuse that goes right to the top. I said, yes, it could, but this is a risk we took. Having said that, this seems worse than that, because even in those cases, I'm repeating myself because I am gobsmacked and horrified at the normalization of all of this. If there are 300 so-called care centers, then 300 have obtained a license to operate. Obviously, they're needed in society, but now you don't have a place to take the spillover, first of all. Secondly, the registration is actually criminally abused. I mean, you've been very polite here with the words used and with what is actually happening in these places of care. These are worse than those Victorian asylums. Well, maybe not worse. I've seen one or two that are just harrowing, where women were abused. And here, apparently, if a girl, one of them has reported her brother raping her, the word used, polite word was abuse. It's rape. There are laws against rape in this country, and they have to be implemented. And you're speaking to me about the gap between laws and obviously and the conventions we ratify and their actual play out on the ground as relief to citizens who are entitled to that relief and protections both. Now, that gap, as you recall, was presented in another outrageous report here about 2 years ago, if you recall, a law commission report which was taken up by you because the law commission report really didn't find its way to our desks or our scrutiny. To this day, I'm using that horrific number to speak to a situation which is currently under review in the Human Rights Committee of the Senate. Now, what was this? This is about the gap between law and implementation. I mean, we spent so much time and so much midnight oil or, short energy trying to make the laws that would protect the women. This is from 2002, Rabia, if you remember. Yeah. I know a slew of women's protection and empowerment laws was introduced from those parliaments from those days. And they make their way into a human rights discourse and amendments today also, that what we did certainly was normalize the human rights and women's rights conversation bang in the middle of a parliament that wasn't used to even looking at that. So, okay, we did that. And we thought, well, our work is done. We were very wrong because as that Law Commission report tells you, even for all crimes, if you pick up all crimes against women, including rape and acid crimes and other domestic abuse, violence, sexual, the gap is 5%. Meaning, what's going on here? That only 5% of these crimes are reaching conviction levels at various courts. There are over 400 courts for gender violence in this country, across the provinces, across all of Pakistan. So you have to sit with that and wonder, what is it that makes the prosecution so weak about women's cases, particularly rape? And what is it that makes the judges, the lordships and ladyships, able to digest the obvious lacunas in what is being presented for adjudication and for justice? So, I mean, we can talk about the justice system. I don't want to spill over. I believe you have 5 questions.
I've cut them down.
So mine just carrying on, so please cut me off.
Well, Sherry, as a parliamentarian, what steps do you think can we take to ensure that systems work and that they protect women who are isolated or vulnerable? How do we, and especially when you have families that are putting them in,
it's often families.
How do we fix this system? Have you thought about
this? I think you know as well as I that even if you encase such practices, this culture, in a web of laws, people find a way out. Obviously they have. I mean, this is bestiality. This is absolutely unthinkable in this day and age for women just to be locked up because they chose the wrong partner. I mean, they're being killed, I know that. They're being killed. That is what honor killing is about, and every other day there is a heinous crime reported in the national media, and we bring it up and we talk about it in the parliament. Obviously, that's not enough. But okay, let's go through the steps we need to take. One of them, obviously, is this. The first is an investigation that has been, had its methodology fairly unchallenged. I mean, your methodology is not challengeable, nor are your credentials, I would think. You're a government organization that has done their job and is doing their job. Now, if others were also doing this, we would not be having this heart-rending conversation. And if your heart is not rent by this, time to go home. Because if there is a dearth of compassion in governance and legislation, and you're part of the government spoke of the wheel, right? Then you have a very serious problem. And I suspect that that is what's happening at the ground level, where doctors and nurses and paramedics and clearly non-qualified people are able to become, for money obviously, for profit, become the jailers of inconvenient women and men. Because these centers, as you can see, are being used for putting away parents that have become difficult to care for. That's what's happening here, the old people. And the one thing that Pakistan or all of South Asia, even the rest of Asian societies have in common is a respect, regard, and duty of care for people who have grown old. That is how we are different from the West. We don't farm out our parents and our aunts and uncles who become inconvenient and difficult to care for. But here you see the beginnings of that. Here you're seeing the beginnings of a system that just isn't. This is broken. Any system that allows, I'm just going to be very clear, I'm appalled that the registration process and the
5,000 rupees.
What is the name of the organization? IH?
Islamabad Health Regulatory Authority.
And they're okay with this? They're sitting tight, not running to their minister or to any parliamentarian who's available or to a TV channel or to Arabia. They did not approach you, right? We've discussed this before. They did not approach you. So this is normalized. What outrages me is that this entire chamber of horrors that they're running, that's what it is. Please give it that name. This care center of horrors is normalized by its registration.
And Sherry, just to let you know, the first case we came was a girl who wasn't marrying the man her mother wanted her to. Manzoor Saab rescued her, and she went to, the girl was suffering from some form of depression, and they went to somebody in PIMS. And the PIMS guy said, oh, there's a very good center, and they sent her to this center. And later on, we recovered that there are a lot of doctors who are on the board of these centers. So it's all a nexus.
And they're complicit.
And they're complicit. Yeah. And the mother paid 2 lakh rupees. And there are also tiers of centers. So one board or one ownership of a company of a regulatory center will have a cheap center where they'll have nothing for poorer people, then a middle-level center, and then they'll have a 5-star center for parents who can afford to put their children in a bit. And most of these boards have doctors who you and I would go to, who are all, and there's this big nexus of control.
So I would like a list of these doctors who are allowing this.
We wouldn't have the list, but we could certainly, I think one of the laws is that there should be a conflict of interest.
They have to disclose this.
And there's no conflict of interest in all of this, you know. So it's operating just as a money mafia. And so I'd like to ask you...
That's why there's a Hippocratic oath for doctors, because they're not operating, they're not sitting in a factory making widgets.
Exactly.
Or sliced bread, even that will require some level of
So we have about 300 of these centers operating
300
in Islamabad alone.
Unbelievable.
And there is little or no oversight, indifference completely. It was when we woke them up. We also have a regulatory authority that's got good rules but doesn't do its job. Now, we haven't even gone into the other provinces in depth. We only
I
got
think if
into
we start here,
Islamabad.
then we can provide the provinces with a template to work with.
And then we are, as a commission, faced with the reality of that one girl who's missing. So when we started repeatedly going to the center, they didn't show her to us first. They took her to the other center. They have 3 of them. And now that girl has been returned to her family, and we know she was pregnant, we know there was an abortion, but we don't know how to get her. So there are these questions facing us all the time.
So I'm going to invite you to make a presentation to the Human Rights Committee of the Senate. Have you done that yet?
No.
So I'm sure that she won't mind. Senator Mumtaz is a
And I think,
colleague
but I
who
think
will be
we've
very
done our
happy to
story,
allow this.
and that's what I want to ask you is, as Parliament, I think the story now lies with health, and as Parliament,
Well, there are many steps we can take.
what can you do?
There are many steps. First of all, the reason I asked you to come into our offices, I'm going to ask law department to come in, I mean legislative law, from the parliament to sit with us and tell us what laws can be tightened or remade or made, 3 different layers, to stop this. Now, when we say stop, you know, you have enough experience as I do, that nothing quite stops anything, right? No law. But obviously it is the tears of those who execute these laws, who allow gaps to slip through, and who are able to criminally exploit the system by misinformation. So the first is, there is no transparency. And from what I can see, I can tell you that there seems to be no transparency in the way these centers are run. They're not transparent. No. They have to be totally like a glass bowl, or they need to shut down. They need to have some system where when families admit members, right? When you're admitting a member, most of the time, from what I can see, it seems that they're putting away inconvenient members of their family. Yes, for sure. It's not a cry for help, which should be the case here. And nor are these centers seemingly capable of help. They seem to be detention centers. Yeah, they're detention centers. And so these detention centers dressed up as care units, first of all, they're private sector, which is frankly, I mean, their licensing all has to be reviewed. That licensing has to be reviewed. And the MNAs are sitting here, I know they'll take it up. I know it. They will take it up there also. But the licensing will be reviewed, and it needs to be reviewed. The health ministry has to be involved at the highest level. The law ministry and the health ministry. I'm certainly going to have the law one in my office when you come in, both of you, and possibly at the minister level, because the minister himself is concerned about these things. And it is only at that level that we are going to find a credible way of redressing the gaps. So the licensing, the health ministry's obvious inability at this point to have even identified this gap or understood what it means, the drawing in of the health ministry, the taking this case to the Human Rights Committee. They have a suo motu power, like all committees, they can call you in at my request, which will then again give you another venue where law officers and health officers will be available to bridge the loopholes in the law. So the registration and transparency of all these centers will have to be reviewed. I would suspect some would need to be shut down. Many would, unfortunately for them, need to be shut down because these are informal detentions. I have not read the report because I've spoken to you about it, and I was reading it while we were talking. And these seem like detention centers for unruly family members or inconvenient family members, especially inconvenient women. Yeah. So we will have to treat them as that, and those that are exceptions within a period of 6 months, will have to demonstrate that there are exceptions. You have to give a timeline for everything, otherwise it just falls between the cracks. So that's what I would suggest. And also, there will have to be a criminal negligence clause put in. I don't see anyone being penalized.
Yeah.
I don't see anyone being penalized, and I suggest that you recommend that as well in your recommendations. They're comprehensive, but this should include a criminal penalty, not a Pakistan Penal Code penalty, a CRPC penalty. For those found violating obvious norms. You must have a template of norms, right? So these are not mental health facilities, these are detention centers. These are pagal khanas of the 19th century, if I may use this term. This is which would still, I mean, my hair still stands on edge when I think about it or talk about it. And to find that this is happening every day under our nose, and there is a victim that you were able to film, her story, the other ones, I mean, there are so many levels of criminal liability here. How in Pakistan a doctor cannot examine a patient alone if he's a male patient, a female patient. He's got to have a woman in the room, a paramedic or a nurse or someone. Most of us do ask for that because there are constant and egregious lapses, even with somebody like me. So this is not, even when you tell me that they're going into a room and the male staff is physically manhandling a so-called patient, because she's obviously not a patient, she's inconvenient, or audacious enough to ask for her rights under the Constitution, because all of the cases you've talked about are educated people. And that is why it is even more horrific. They are normalizing confinement and detention and a lifetime of mental trauma and abuse for their family. They're willing to do this. They too will have to be penalized, I'm afraid, in a cascade of penalties. I would suggest that. I know my colleagues will likely say that's too harsh, but first of all, the care center, the doctors, the board, they will have to be made answerable in a system of penalties. Without that, this is going to fall. So how can and the licensing authority will also have to be made answerable. It's not enough to say we don't have, I know you don't have capacity for half the laws we make, but this is criminal negligence, and for that there are penalties. Right now I don't see any. They have to be built in. That's the first way to deter institutionalized impunity, which I see occurring here with great aplomb. I mean, to think that anyone can get up and just without access to rights, I mean, has a case been filed against anyone? Have any of the so-called patients or people who have been confined come out and had the nerve to file a case? Probably not. No. I'm happy to help them do that in my personal capacity, but they should be encouraged and supported. What is I mean, we have human rights ministries, all these commissions, conventions we've signed. Internationally, you know what they mean, Rabia. But I really don't care even about that. I care about our commitment to our own citizens. Where does that go? That should come first. And that's needed right now. The people who are misguided, they will make the plea in courts. The mother will make the plea in the court, or the brother, or the husband, or the abuser, the father, that I was misguided and misinformed. That's the plea they will take. That cannot be a plea. Ignorance is not a plea in court. I didn't know is not a plea. It's not admissible. So they will have to say a lot more that we did not know, that Xanax was, someone taking Xanax is admissible. My goodness. And mental health is a very, very big problem in Pakistan. So people are not clearly being helped here. Those who are genuinely mentally ill are not getting the care, number one. And number two, these private detention centers make money as proxies for abusive corrective behavior. So you drug someone and abuse them so much that they become so scared, they become so terrified that they will never come out and challenge that. One of you read that story. I wish I hadn't said that. Her brother had abused her. And she regretted saying it because she had to go forward and live her life among such people. She was negotiating her freedom to breathe outside the walls of this abusive detention system. So, I mean, I can go on, please,
Well, thank you. We've run out of time.
Yeah,
Thank you so much, Sherry, for coming, for being here.